Everyone, this month is Women's Health Month, so I had a little extra time since I'm going to go ahead and let one of my fellow female health coaches take this one. Just got done with a little workout. Take it away, Candy.
Hi there, everybody. My name is Candy Walsh. I am a registered nurse and a certified health coach with Cerner Wellness, and your amazing wellness coach and my amazing colleague Jonathan Wood has asked me to speak to you today because it is Women's Health Month, and I think the topic might have intimidated him just a little bit. But specifically, Jonathan wanted me to talk to you about women's preventative screening exams. And for today's purposes, I'm going to talk to you about three in particular. They would be women's breast cancer screening, cervical cancer screening, and osteoporosis screening. So I invite you ladies to just kick back, grab a cup of coffee or tea. Let's talk tatas and other girly things. So it's recommended by the U.S. Preventative Services Task Force that women ages 50 and above have a mammogram performed every 2 years. Of course, if you have a family history of breast cancer or a personal history of breast cancer, that would be a different recommendation by your doctor. In addition, it's recommended that you perform a regular breast self-exam. What this does is it gives you an opportunity to both visually and physically inspect your breast to check for any signs of dimpling, lumps, swelling, redness, any kind of unusual nipple discharge, or just anything abnormal with your breast. And most women will perform this during the time that they're taking a shower. And it's just recommended that you just use your hands and work in a circular motion from the outer portion of your breast all the way working toward the nipple area. When you get to the nipple area, you can squeeze gently to check for any discharge. And there should be no discharge unless that is you are a nursing mother. But any nipple discharge is abnormal otherwise. Don't forget to check this area called the tail of Spence, which goes from like your armpit to the breast, because there can be lumps that form in that area as well. Moving on to cervical cancer screening, it's recommended that women between the ages of 21 and 65 have a pap smear performed every 3 years. What's a pap smear? It's where your doctors go in and take a little sampling of the cells of your cervix. Your cervix is the opening to your uterus, and they check for any kind of abnormal cell formation. So between the ages of 21 and 29, it's recommended that you have this pap every 3 years. If there is no abnormal pap, you're good to go, and continue on with this every 3-year cycle. But if you do have an abnormal pap in this time frame, it's recommended that you then have an HPV test. And what that does is it checks for abnormal or unusual infection, and which could lead to atypical cell formation or cancer. So if you have an abnormal pap between the ages of 21 and 29, you may be asked to have the HPV test. Now for women ages 30 to 65, that pap test is recommended every 3 years, but in addition, the HPV test is recommended every 3 to 5 years. For women who have had a hysterectomy or the removal of your cervix and your uterus, or if you're above the age of 65, just talk to your doctor about what your needs would be for cervical cancer screening. So moving on to osteoporosis screening. For women ages 65 or above, it's recommended that you have a bone mineral density test. What this does is it checks for the strength and the hardness of your bones. Now, if you're under the age of 65, but you may be at high risk for osteoporosis, meaning you have a family history of osteoporosis, you're underweight or a thin-framed woman, if you eat poorly and don't get enough calcium or vitamin D in your diet, if you do not exercise and do weight-bearing exercise, or if you smoke regularly and drink alcohol on a regular basis, those could be some things that would put you at a higher risk for developing osteoporosis. So you might need to have that bone mineral density test performed a little bit earlier. If you're looking for other screening tests that are not just specific for women's health, I encourage you to check out this really cool tool in the Wellness Portal. You would go to the health library and do a search, and you would search health screening. And it's going to pull up this interactive preventative health screening tool, which I just love. And what it does is it asks you to provide information including your age, your gender, your health history, your lifestyle habits, and it's going to create for you a specific a list of recommended preventative health screenings that you can then print out and take to your doctor and talk to him or her to determine which would be the most beneficial for you at this point in time. I also recommend that you schedule an appointment with Jonathan. He's an awesome coach and he can really help you work toward those health and wellness goals that you might have. He can help you create a customized plan that's totally doable for you. So schedule your appointment with Jonathan as well. I hope this was helpful for you. I hope you have a great month. Make it a good day and be well.